Megan?
Thank you so much. I'm always in awe of being in a room of people who focus entirely on helping people. So I feel everyone's energy even over the internet. So the Michael and Susan Dell Foundation has committed about $1 billion over just more than a decade on children's health, specifically transforming the lives of children living in urban poverty through their health and urban education here in the United States, in India, and South Africa. And we are really an outcomes-based foundation. And we have a history of funding interventions on the ground where we look for measurable outcomes in children's lives. And you can ask any of our grantees, the first word that will come to mind is they want measurable outcomes. So we are hard and fast on that. But we've tackled childhood obesity in a variety of ways. A lot of the funding has been through improving access to, or improving physical activity for children through the support of organizations that run programs like that. Supporting initiatives that increases kids' knowledge of and access to healthy foods, as well as supporting organizations that make neighborhoods safer. But time and time again, we ran up against the same twinned challenges, isolated successes against a backdrop of public complacency. And people, I think, are very numb to the facts. Just building on something Kaya said, the statistics that were released at the beginning of August, that same week, there were 3 other statistics released about leveling off of obesity rates and increase of obesity rates in some parts of the population. So we confuse the publics about what the right message is. And that goes to one of the reasons for the weight of the nation and a healthy America. But there's no wonder, because we live in what I would call generation hashtag. You can take that, Pew Research, you can have that one. Where we are seeing the simplistic narrative really drive what people are consuming in terms of what they know or what they want to know, and that's only going to get worse. So John cold called me, and this is a really big cold call you're doing now today. I told him, look for scale, so he did. But actually, the day he called me was a rainy Friday afternoon in Austin. I was on my treadmill at my desk. We were way ahead of the curve. This was almost 4 years ago. He didn't believe me until he came to the office and saw the treadmills at our desk. And I would say our first experience, myself and my partner in crime, Dr. Aliyah Husseini, who runs our health portfolio at the foundation, was giddy anticipation. John and I talked for 5 minutes where he told me about the prospect for a weight of a nation. It didn't have a name then. It was, I got this idea for this obesity-related thing, and we were on a plane to New York within 4 days. And we presented it to the board about 4 months later, so we were pleased to be the first funder to come on board for that project. And from the very beginning, the team was incredibly open and willing to talk about our views and the experience of our grantees and bring them to the table. And I think how I would characterize our feelings now, 4 years later, is exhaustion and inspiration. And I use the term exhaustion in a really good way. It's meant to be positive. Because of all the things that happened, I think what was anticipated this project to be and what it turned out to was certainly larger and more fantastic and had further reach than we ever believed. And for us, it was very much, as a grant maker, a step outside the box. I mentioned about doing funding on-the-ground interventions. So for me to take this to our board and say we have this storytelling idea. We want to work with master storytellers, HBO, and these wonderful scientific luminaries. Here's the idea. And Michael Dell is a very numbers-driven guy, and he said, how are you going to measure the impact? And we got to that. And Susan wanted to know exactly what impact this was expected to have on children. And so that's where we started with HBO, and luckily, it wasn't an accident, I think, that they already had in mind where this project was going to go. I think with the project that's being put before you, it's important because we need to meet people where they are, and that's why the idea of a multiple channel communications platform is necessary. And as Susanna talked about, and I came out of the technology world, so I see how technology has impacted culture. And now we'll see the intersection of content and technology potentially changing culture. And there's some additional future forces that will really affect that, like the rise of kids tech, or kid tech, right? There's a generation now who doesn't know what it's like not to be online, but how they learn will be different. And of course, every generation before us has said, these kids are crazy, and I know we're all saying it now too, But that is changing, and we need to get out ahead of that. Another trend toward making data and information more visible for communicating well-being, just as Susanna was saying. This is something that will come and is coming, and so we can take advantage of that. So the point is, how we consume information, how we look for information is changing, and to change culture, we need to be ahead of that. And as a grant maker, I think there's different ways you can look at this project. You obviously bring financial capital to the table, but also think about the intellectual capital, or the human capital, or the social capital you can bring to this project. And that's what I know the team is looking for. And also the relationships you will build with others in this project, and how you can leverage that on the ground in the communities in which you work. And we have certainly seen that with our work in Weight of the Nation with the partners. As I said, for us, funding storytelling was somewhat out of the box. But for me, the idea of launching a mass-scale conversation about an issue that was near and dear to my heart, especially with having 2 young children expected to grow up in a world that was going to be very difficult, it was fascinating and, like I said, inspirational. So A Healthy America is about, I think, the way we look at it, also building a value brand for society. So think about it that way.
Thank you. I'm going to turn it over to our technicians now so they can bring Tony Iton online.